open up the meeting. It is July 22nd at 4:05 p.m. Thank you. And this is a meeting of the Lake County Board of Health. Sorry, I'm still rusty at running this meeting versus others. Should I just do a quick review of the agenda and see if any of the Board of Health members have any additions? And I guess I will start off. My understanding is that our intent is on item number 3, that we will table that to a future date, but that we will run through the other items.
Okay, and I know that Colleen is not going to join us right away because she's trying to steer anyone to this call who might join the other call. I think that she had mentioned we can adjust the order of the agenda then. If Paul has anything that would like to go, you can change the agenda.
Okay, great. Jackie, thank you for that. So I will go ahead. Well, actually, sorry, are there any other proposed changes? And if not, I'll go ahead and entertain a motion, but I'll just pause for a second and see if there are any other adjustments or amendments to the agenda. Hearing none, I will entertain a motion for that we move item 4, the report from Paul Clarkson, up to number 2, and tackle that backcountry zoning first. We will leave number 3 on the agenda, but with the expectation of not opening the public hearing, but tabling that item for a future date. So if someone would.
This is Kim. I can make a motion for the approval of the agenda with the recommended changes.
Thank you. And can someone second?
Second.
Excellent, thank you. Then we will vote. I will vote yes. Sorry, I'll go through. Kim?
Yes.
Cornelia?
Oops.
Okay.
Yes.
Okay, thank you. Steve?
Yes.
Okay, thank you. Great. Then the agenda is approved, and Paul, I believe the floor is yours.
Thanks a lot. I was hoping to be able to discuss this kind of in conjunction with Jackie's request on number 3. But I think I've spoken about this to the Board of Health before, and how this relates to you is very much what Jackie wants to talk to you about. I think the main thing is that we're entertaining a zone district that encompasses certain areas of the county that would be considered to be back country. Not easy to get to, not easy to get emergency services to, not easy to get utilities to. And what we're entertaining here is that there's a lot of those backcountry parcels that are actually former mining claims that want to be able to build a backcountry hut or a ski hut or a hunting cabin that has considerably less requirements than building a house here in Leadville would require. They would only be looking at living in it at probably no more than a couple of months out of the year, because the only way they can get to it in the wintertime is by snowmobile or skis, which is exactly the kind of thing that they're looking for. These are usually on approximately 10-acre parcels. And the intent is to allow for these to be built without water or septic system. They bring in their own water, and they either have a vault or a true pit privy. Again, I don't want to step on Jackie's toes about discussing this, but I think that's the main issue that concerns the Board of Health, is the fact that we are going to be entertaining, probably a couple hundred eventually, backcountry cabins on 10-acre parcels that will not be further developed or will not become subdivided parcels. And the intent is to try to maintain the backcountry nature of these areas, as well as access to them is highly restricted. That building a road is something that we'll consider very seriously in order to do it. But I think there is a demand for this, and we've been trying to pull this off probably for about 10 years now. And we're still having trouble because of other demands on our services. So if you have any questions, ask them.
Well, I guess I can start, and maybe first of all, just sort of apologize for myself and also on behalf of Commissioner Marcella for not getting our head around what was on the agenda tonight, and also the scheduling conflict. We should have anticipated that with the other public hearing. I guess a question for me is whether I don't want to open up 3B, but I guess without getting into the agenda item 3B too much, like, how does the new proposed backcountry zoning that I think will get over the finish line soon interact with the proposed change to the reg in 3B? And sorry, I'm like really stumbling blind. So I think, I don't want to get too far into it, but if there's something quick here, or maybe it's just like something that I can sit down with staff on and get educated on before the next meeting.
Basically, the requirement is that a new house requires a septic system.
Okay.
Some form of a septic system. And generally, you can't have a septic system unless you have water. Mm-hmm. So what, the thing is here that what's going to be amended in the code, what is currently required is any kind of a variance from that requirement of needing a septic system is now required to go directly to the Board of Health. And the nature of the discussion that Jackie wants to have, I don't know whether it's going to be today or later, is that should be left in the hands of the environmental health staff, to which I completely concur. I think that this will probably considerably reduce the amount of bureaucracy that it takes to build a backcountry cabin.
Yeah, okay, Paul, that was super helpful, especially for me, that point about, you can't run a septic system without running water. That makes a ton of sense. I guess, we'll open it up for discussion of others. That I do know that Commissioner Marcella, and I agree with her, had requested, with apologies, that we just have a little bit more time to like look at this and ask some questions, and just get our heads around what's going on with the backcountry zoning and this proposed language. I don't think there's any opposition, just we literally just didn't have the time to read it.
I can, hey Jeff, it's Colleen. And so I can totally appreciate that. And I think, you know, part of the question, I think what you're talking about, Paul, is really only specific to backcountry cabins. It's not necessarily, right, all the variances that do come across for, you know, because this, like a backcountry cabin, to your point, it's a very simple kind of like vault privy or something very, you know, non-complex, so to speak, septic system. And that's all that we're kind of talking about. Like that would cut through some of the pieces for each, specifically, not necessarily all the variants that we currently have to, or we, the Board of Health currently has to weigh on. Am I interpreting that accurately as well? Like we're just talking backcountry. Okay, I just want to make sure. I think what's, you know, sometimes challenging is, you know, we're so appreciative of the Board of Health being, you know, being available, and we keep coming up with more and more and more, you know, variants in these places that people are building. And we know the ultimate, at least, and Jackie, feel free to chime in. We know that the ultimate solution to that versus like a variant process is having like a higher level, right? We all get that we have the ability to put in higher level, but that means we have to have an oversight program, which means like a yearly like update from every single one of those particular systems, which doesn't happen now. We're capturing systems, as you guys know, with the, I always say it backwards, title transfer title program, where we're catching septics that we haven't put an eye on in over, you know, 10 plus years, and versus like an oversight program. So I just like to just put that on the table of recognizing like, hey, that is the need. And I know I appreciate the recognition too from the Board of County Commissioners, recognizing the insane rate at which you know, permits are coming in, and trying to keep up with them with, you know, our current staff, not only in public health. And, you know, I don't want to speak for Paul, but I'm pretty sure that he would feel similarly in the sense of the increase in volume. We could at least agree on that.
Yeah, and I'll just say as like one person, like the, you know, if to me, it also makes sense. Like if we keep getting variance requests and they make sense to us, then something's wrong with the code. You know, so I appreciate what's going on here. I think again, it's just literally bandwidth for Kayla and myself about like not being able to read this before 4 or be present. So
Yeah, this is Jackie. If you don't mind, I could certainly just give a little bit of backstory to this. And I am super apologetic for not getting the information out to you all sooner. It's been a crazy week, and I'm just so failed to send the information out early enough. In 2018, we changed the septic system regulations, and one of the changes included the limited use occupancy, and we're still just trying to make our regulations more accommodating to folks' needs. So as this program has been developing, this is now just becoming one of those items that we're recognizing could be done a different way. It can save staff time. It can save our Board of Health time. And I checked with the state, and the state was able to confirm that this is one of the only areas that they could help identify as a loophole that we can reduce out of Board of Health variance time and have staff approve. So that little blurb that I put in the agenda appears to be approvable by CDPHE as the only loophole that we can do to try to limit the number of Board of Health variances. And this will only be for systems that are limited occupancy or no water. If there are any other reasons for a variance, it would still have to go through the Board of Health.
Okay, great. That's super helpful to know to know that background. Sorry, hard to read the room on Zoom. Are there other people who want to ask questions or chime in here? then at least from my perspective, I think I certainly have enough information, and I know we're recording this, and Kayla can catch up on this discussion, which I think was super helpful. So unless anyone else has any comments or questions, I would close out this agenda item. And again, I'm talking slowly to let people unmute and hop in. Maybe we can go back to agenda item number 2. Colleen, if you wanted to do a COVID-19 update, if
Yeah, absolutely. I apologize. The Health and Happiness Project, as you guys know, we took care of last time. That just is our public health improvement plan that we are continuing to implement through the different coalitions and the work that's being done in the community. So, but as far as COVID-19 goes, the big concern that we have right now, as most folks can guess, timing wise, is the back to school piece. The state just came out with guidelines earlier in the week, along with the Colorado Department of Education. And they're just that, they're guidelines, they're recommendations. There are no requirements. What we're seeing happening in some other districts that haven't been so happy about any of the COVID-19 restrictions from the beginning have really come out very quickly to say, we're not following that. They say we don't have to quarantine. They say we don't have to wear masks. They say because it's not required. And so, have made decisions very quickly. Ironically, some of these places that the districts that are saying we don't want to have any precautions in place are also some of the hotspots that we have within the state. So take that at how you want. I have been in touch with Bethany, the superintendent, and just trying to gather, like, what do we think is going to be best practice here? We're talking about vaccination levels, so I can pull. So currently our caseload, like, we are averaging about 4 cases a week. It's still kind of happening in a family circle. It hits, one family and 4 people in that family get sick. We do have 3 cases currently that we are sequencing to see, because this was a family that was fully vaccinated. And so we felt it was important to see if, because of their severity of illness, they're not hospitalized, but it was enough because they're fully vaccinated to see whether or not the Delta variant, if it is the Delta variant, as most of you know, the Delta variant is the most common that's circulating across the United States right now, including Colorado. There are cases in Chaffee, Eagle, like Summit. So I can't imagine that, as we always say, it most likely is here. We're hoping to get some confirmation so that we can push out more information. We do know that the vaccine is effective against, not only the Delta, but other variants, in the sense of not, reducing illness, as well as, not having hospitalizations and or death, which is really positive. So even though it's not 100% effective, it still offers quite a bit of protection against all of these variants. So we continue to push that message. Part of that conversation, though, around the school is, we don't have 70% yet of our community having at least 1 dose. And some of the recommendations coming down from the Colorado Department of Public Health and Environment is kind of trying to use some of those metrics. Hey, if you're at 70% and you have low case rates, you got to think about your layers of protection. And so for us, those layers of protection that we've had in the school, have been distancing, have been masking. Obviously vaccination is a big one that has come online, testing, symptom screening, that kind of thing, and just trying to figure out what will work. I think, as we know, and we've had a lot of conversations, as some of these restrictions or as some of these protections have been peeled away, that it's very hard to kind of keep them or, put them back in place. So, and to balance that too, right? The vaccinated versus non-vaccinated, as we both know, that is a flashpoint, not only nationally, but even here locally and in our school system of, the mask piece. And so we're trying to figure out what really are good metrics. Between Bethany and I, we are reaching out to all our counties that are adjacent to us, just to see what they're doing, so that we're not like an outlier, like we're doing all these things and we're the most restrictive. And as you can imagine, that actually doesn't bother me. We're the most restrictive, but I understand the balance that is needed in the sense of our region. And so that is kind of where we're at right now, and trying to figure out if we can hold a vaccination clinic at some of the orientation, specifically at the high school, because vaccines are only, what's the right word? Someone give it to me. Or only allowed, I'm saying the wrong, or only, what's the right word?
Approved.
approved. Thank you. I'm like allowed, approved for ages 12 and up. And so we continue to work on vaccines and that kind of thing. Like I said, our caseload as well. And unfortunately, as we know from all of the science that is out there from the Delta, is the fact that it's twice as infectious. So, you know, we are putting up banners around entrances into our community saying if you're unvaccinated, you know, please wear a face covering or a business requires it, just because we just don't know what's going to happen here in the next month or two. We have asked the state to say, do we have any kind of trigger levels as far as if this happens, we need to think about, like, remember that dial, like, is that gonna come back? And then you can you know, are we gonna go back to anything kind of a thing? And I think, as you can imagine, there's just definitely, we're not getting definitive answers. I've been working on communications. I've been sitting on a communication group to say, hey, can we get things less than 30 minutes before they go out? Unfortunately, CDPHE is saying that is still when they're finding out, that the governor continues to kind of say, hey, this is what we're doing next, and pushes it out to the public, you know, right after us or right before us or simultaneously with us. So you would think after over a year that we would be better at this across the channels. And so that's continues to be, as you can imagine, a frustration for, you know, not only us, but even having that conversation, you know, with Bethany in the school district and, you know, is it going to change? What are the triggers? I'm like, I know we're asking, you know, because we're all thinking the same things. If Delta really hits hard, especially in our unvaccinated population, like, you know, what does that mean for our community, especially if we get a surge and our surrounding communities don't? Yeah. So it's still a lot of, it feels, once again, I hate to say it, it feels very Groundhog Day-esque. And if we don't get people vaccinated, as you know, with anything, that's when you think about like the whole like antibiotic resistant strains that have come about because people haven't like completed their, you know, antibiotic series. It's similar in the sense of like, the only thing a virus wants to do is live and survive and get stronger and reproduce. Like it's, that's it. And it's really effective at it, at changing and adapting and getting stronger. And so if we don't get more folks vaccinated, we might have to switch strategies in the sense of a different vaccine or whatever that looks like, depending on what, you know, we're only on Delta, right? Alpha, beta, Delta, right? Alpha, beta, right? So we're on 3. I think there's 5. I'm trying to remember my Greek alphabet of how they're doing it. I don't think they're doing it as a Greek alphabet. I think they're usually doing alpha, beta, whatever C was. But anywho, and we're only, you know, for vaccinations, we're only like 6 months solid in. So
is it is there any discussion of requiring vaccinations for eligible age groups or for households, or is that just like wildly off the table?
It is not off the table. In order to do that, in order to have a vaccine where you actually can have some teeth and you can make it like a requirement and a mandatory, it has to be FDA approved. Right now, the vaccines that we have are emergency use authorization. Right. And so, you know, there is conversation. FDA fully recognizes that, but to their credit too, like this vaccine has only been for a year. Like they don't want to pre-jump to approve it. And then also they don't want to pre-jump to approve it and be like, oh my gosh, there's an epsilon, you know, variant that just come out that is not, none of the vaccines are effective yet. We approved this, yet this new one's taken over and we need a new vaccine. So I understand why, like, and so that's, that is the information that's coming out, right? Of why they're kind of like, well, we're just kind of like, you know, you hate the wait and see thing. But if we truly get,
also, I mean, just politically and practically, like, oh my God, like given where we are, I can't even imagine what that would stir up.
Right. And so, I mean, that's their point. It's like, if, you know, if we can get more people vaccinated, which we already know that the vaccine that is currently available is effective against Delta and all the other variants at this point in time. But I think the point is if we get something bigger, stronger, better, you know, virus wise, the vaccine we have may not be the right, you know, combo when the time comes. So that's why they're hesitant. But basically, if the FDA approves it, then we have the ability, because then it goes through ACIP, Academy, something, immunization practices. But basically, they are like the gold standard of, hey, this is all the recommendation of school-age vaccine, and now you can require them, kind of thing. And so that's just going to take time. And I think the difficult part is that people continue to live like it's done, but continue to spread it. And that's the unfortunate part that we're seeing. And so luckily for us, you know, we're still seeing, you know, little clusters, and we continue to see, you know, like I said, we had that outlier of that family that we are testing for a variant just to see what strain it is, because we're guessing that's what that is. But we do have pockets, of unvaccinated people here. We're only up at 63%. And I can pull the graphic if you guys would like to see it. I will be updating that later today. So that will go out and you guys will see that as well. But I'm probably going to end up doing it tomorrow morning just to see where our vaccine numbers are. But
Any other questions or comments?
Yeah, or
Yeah.
feedback or what we can be doing or.
I have one.
Yes.
I kind of consider anybody that's not vaccinated is an anti-vax hole. And I would like to put a sign up in my office that says, if you're not vaccinated, here's a mask, or we can't talk to you. I don't know how that would go over. Jeff, maybe you might know better how that might go over in a county building.
Loaded question. So because we're a health facility, you cannot enter our facility without a mask, and we have masks available when people walk up and they're like, we're vaccinated. And even if you're vaccinated, we don't make that distinction in our office. We just like throw a mask on. But because we're considered a healthcare setting.
Are you masked 8 hours a day?
We're masked when we interact with public. We are not masked when we interact, and our rate, as you can imagine, is like 100% vaccinated.
That
in our office.
Yeah, I might. That's something we could consider doing. Is whenever we have a customer, we wear a mask and ask them to.
I mean, I think my understanding is, you are absolutely welcome to wear a mask yourself.
Mm-hmm.
If someone objects to that, then they can leave. I'll back you up on that.
When you wear, do you ask your customers to wear a mask?
Colleen, my understanding of where we are, like in terms of guidance, is like you can ask people to self-declare whether they're vaccinated or not, and be responsible and wear a mask if they are not. That is what they should be doing. And you can ask them, but you can't ask them for proof.
Right.
So the reaction that I get is sometimes that's kind of personal, isn't it? Well, no, it's not. And what I want to be able to do, though, is basically put the word out there that you're only hurting yourself by not getting vaccinated. And what little I can do is not do business with them.
Again, like when we've interviewed people in person, like I've asked them, this is in person. Your interviewers will be vaccinated.
Yeah.
Here's the deal. So I don't know if Colleen advise us further, but
yeah, I think what's so hard is that because we can't. The struggle that we've had from the beginning, Paul, is that we can't get universal compliance, within our county departments, let alone the public. And so, if there was a policy across, we have the loophole of healthcare that hey, we're a healthcare setting, everyone wears a mask, vaccinated or not, which is helpful in that respect. But I think, to Jeff's point, you have the ability to protect yourself, as always, and that's right. We've had that conversation, do everything you need to protect yourself. Keep your guards up that you guys have, the plexiglass, those, you guys haven't pulled those down, right?
No, we haven't done that.
Okay.
I've seen other departments
pulled those down.
Other departments have pulled that down.
And it's unfortunate, in the scheme of it all, just because, like I said, we nothing is 100%. And if you're not doing any other layer of protection and you're interacting with someone face to face indoors, you're increasing your risk of, exposure if they're carrying, any of those variants, so to speak. So I think that's a conversation within your department, and if everyone could come to compliance, or not compliance, to agreement on that. I don't know that we have any, we have no teeth in it because everything's a recommendation at this point in time. There's no requirement.
Okay.
I think, I just want to add, it's not only they're hurting our community, they're hurting the kids that can't get vaccinated, they're hurting, folks that don't have the ability or haven't been eligible yet for a vaccine. And it's I'm hoping once again that we get passed over in the sense of not getting hit as hard, or our hospitalization. But I'm telling you that we've already had a couple folks in the hospital in the last 2 weeks.
But nobody's not eligible, right?
That what?
Nobody's not eligible.
12 and under is not eligible.
Oh, okay. Well, okay, they should be a protected population. we should protect them, which
I
means
agree.
we should be vaccinated. We should be
Yes.
wearing masks. All right.
Which
Well,
is why the school discussion is going to be pretty darn interesting.
Yeah, and because it's not trying to pit everyone, keeping everyone as comfortable, giving the kids, as much normalcy, but also part of our conversation that we've had with the school is we don't want to start looser and then have to get more restrictive. It's so much better to keep it, at least our preliminary conversations, but even that's being met with some resistance of like, if it gets bad, we'll just go back. And I'm like, it's so hard to go back, as we all know.
Yeah.
yeah.
Well,
All right,
maybe
well-
not. We could probably talk about this all.
I know,
week,
we
not
could
to-
all
not to
night, all
disrespect.
night, I know.
I maybe just as one commissioner, I'll say if there's anything we can do to help that discussion with the school district, or just let us know.
Yeah, absolutely. Like I said, preliminary, we're seeing what's happening in other districts now because they just released the guidance this week. So it's now the scramble until, school starts.
And maybe we can talk offline about whether we need to circle back and get some clearer guidance out to departments about sort of what's encouraged, what's required, what can be
Yeah, and just so
required,
I will, so just so you know, Jeff, I will send something to the board here. I'm just finalizing it
Yep.
just to kind of give you the most updated, hey, this is why we really need to be thinking about vaccines and all the other pieces with some of the updated numbers like across the country, just to be like, this isn't over. Let's have that. It's to start the conversation again.
But yeah, and maybe also a quick FAQ sort of along the lines of what Paul asked, is like what can we ask? What are we allowed to ask? What are we not allowed to ask or require? Just a few, not elaborate, but just a few things really targeted to each department. Like, can we keep the plexiglass up? And also maybe like what to do if I'm working in a department that I don't agree with the consensus on, like what's the recourse for individuals? Because I don't know the answer to that.
Yeah, then that'll have to be like you and HR, and we'll have an offline conversation about that.
And maybe it is, Hannah and you and me or whatever. Yeah.
Okay.
Okay.
No worries. Anybody have any questions though about kind of where we're at, or and we're going to start to try to pick up some of our media pieces and some of our messaging, especially going back to school. We did complete an after action report, or we gathered groups yesterday for an after action report for our response partners and everything we have up to date at this point for the response. We got some great feedback and recognize that we've kind of fallen off a little bit as well on our end as far as communication. So we feel like we might go back to like over communicating, and you can pick and choose what you want or don't want, especially as this information continues to roll out and is increasing by the day. So
what is our participation rate, Lake County?
As far as the
who's vaccinated and who's not?
In this, like, what's our latest, like, between, do you mean like in age groups? Like, how do you want it?
Just participation. What's the percentage of Lake County that is vaccinated?
Yep, I'm gonna share my screen here and I'll show you the latest and greatest. So this is where I grab my info from. And so as of, let's see, because we're always one day behind like the info. Sorry, I'm just scrolling down the bottom. So as of 7/21, which was yesterday, so this is where we're at. 64.3% of our community has received at least one dose, which is the equivalent of 4,427 people. 57% of our community is up to date, which works out to be 3,919 people. So the good news is that our first dose and second dose isn't that far off versus other counties where there's a lot of first doses, but like the second doses aren't, trending right behind it. So I think percentage wise, we're doing really well. So since, so we've gone up like 2 percentage points for fully vaccinated in the last 2 weeks. So even if we're calling it 1% a week, at least we're moving versus stalled. The one group that we have seen a stall in as far as vaccination, I'll pull those numbers, like I said, later, and we'll push them out, is our elderly population. Like, they kind of stopped a couple weeks ago. We've not seen any new doses in that age population. So that's 65 and up. But we are seeing a continued growth in all of the other age groups, between 12 and 65. Is that helpful?
Colleen, I sort of find that a little bit disturbing. The patients with one dose, 4,400 people, that's kind of half our total population. And if it's And if we're counting these people as being over 12 years old, it's considerably more than that.
Right, so for the eligible population, Paul, it's right there, 6,881 folks currently 12 and up are eligible, so that's where they get that 64.3. But as you could imagine, when they open it up to the younger group, that number is going to drop dramatically.
Yes,
Mhm.
yes.
It will,
Now
it will totally, exactly.
my disturbance is that I know that when I got vaccinated, I scheduled my second one as soon as I could.
Mhm.
And it doesn't look like that's happening.
Right, and so if you go down to the, I will scroll down to the bottom, and you can see initially everyone was tracking their first and second dose. Right, sorry, I'll come up. Like you can see how the colors are barely, and now you can see there's more of a gap between first and second doses.
Yeah. So there are people out there that get a first dose and think they're fine, or do they think that they're just, no, I think I'm going to become a vax hole, an anti-vax hole.
Yeah, I don't know. I think part of it is we've moved into the summer months. We're outdoors and people aren't thinking about it, and they feel that maybe it's less needed at this point in time. And we have reached out to those folks. We do have the ability to do that. And we have reached out to the folks that have not come back for their second dose, as well as folks that the state has done a campaign to everyone that hasn't received a dose. And we've done kind of a behind the scenes of, hey, we recognize that you haven't gotten your second dose. This is where you can get them.
How does this compare with the state?
Yep, I can show you that too. I haven't looked actually in like the last couple of days. So give me 1 second and I can pull that up as well. So let's see. You guys, if you have any other questions, you guys can talk amongst yourselves while I pull up the state data. It's just going to take me a second.
I think in talking amongst ourselves, are we still, Jeff, are we still intending to hold this hearing that the Board of Health is gathered here for mostly?
As soon as we are done with this agenda item, I will entertain a motion to table 3A and 3B.
So may I ask why? We have a quorum.
We could continue. I will relay. So it would be my request and also Commissioner Marcella's request that we have a little bit more time to just read the documents and have a chance to ask staff about questions we have rather than diving in. But you are right, we have quorum, and if
I guess I understand that. I don't know if Jackie ever sent you materials, but I think Mr. Horning, our applicant, is the one that's getting screwed here.
Sorry, is the one that is what?
Oh, I think basically Paul was saying it doesn't feel appropriate or that to ask someone to wait longer if we feel that we can make a decision today. I will not repeat the word that he missed that he said.
Oh, that anti-vax hole?
No. Anywho, I will just show you very quickly, where we're at. We continue to trend. So, I mean, we're still doing great as far as the state goes. What is that? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. We're like still in the top 20. All right. We're still there. But as you can see, the darker the color, the higher the vaccination for first dose only. This does not equate to second doses. And then as you can imagine, we're still not doing great. We have some of our surrounding communities that are in the 80s. But then you can see as we scroll down in some of our other communities that, we're not even close to 50. So like I said, that's a little discouraging as you can imagine overall, but it's trending just like the rest of the United States. 35% of the population from some of the surveys that have been taken, are not willing to get vaccinated. So even if we had everyone who was willing to get vaccinated, what does that equate to? 35? Is that 65%? We still wouldn't hit our 70% mark that we want. So that is the last piece.
I guess the only comment I can make is I don't understand why every state isn't at 100%.
We could have a whole conversation about that offline another time, Paul. Possibly in my backyard.
Outside.
Outside, enjoying some beverages.
And not wearing masks.
All right. Well, with that, I'm going to stop my screen share and
okay.
And bring it back. And that's all I have, unless somebody has questions. Like I said, our big priority right now is schools, back to schools, specifically for what we're working on COVID-19 related. Obviously, you know, some of the EH pieces that we are inundated with currently. And yeah, it never ends. We might have a bat that we're submitting for a rabies sample, first time ever. So that's exciting.
God, really?
Yeah,
Really?
because you know, that's really easy too, to get a bat and send it into a lab and figure out rabies. So
Yeah.
we can't catch a break. We can't catch a break.
No.
Thank you.
I just thought that we'd be done with COVID-19 by now. And I'm disappointed that we aren't.
I will join you for that backyard discussion with a suitable beverage to discuss human psychology.
A fermented malt beverage, maybe?
I mean, I don't want to judge. So let us move on to agenda items 3A and 3B. And we have a quorum. I would like to entertain a motion to table this. And I think Jackie had proposed a date. Maybe she helped me with that. But we also have a quorum, and a majority could reject that motion and proceed with the hearing. So I'll just reiterate their request from two of the board members, myself and Commissioner Marcella, to table, not for a long time, but and sorry, forgive me, I don't have the date that I think Jackie had proposed available.
Yep, can you hear me okay?
Yes, you sound great.
Okay, so honestly, I do believe that this particular client would probably not be opposed to now missing the meeting, because I did notify him that the meeting was going to be tabled, but ultimately he just wants his permit. He just wants to be able to install. I can certainly share my screen and do the quick presentation. Again, I truly feel that this particular situation is one that part of agenda item 3.B is proposing that this is a decision where it's a very remote install way up Weston Pass, and it ultimately could be approved by staff and not have to table this and bring back the Board of Health to another meeting to do another presentation to approve at a later time. It's not a complicated thing. It's engineered. It's a holding tank to receive septic sewage that would then be pumped out by a pumper truck. Very low risk to the environment, and I could share my screen if you would like me to.
No more than 180 days a year, right?
So hang on. Sorry. I would like to not get into the details unless there's a vote of the board to do so. Sorry, am I not being clear?
Nope. No, you're just not getting immediate reaction.
I have a question, Jackie. Were you saying that we could do something so that this just becomes an approval from staff?
Correct. If the Board of Health was okay with amending Lake County OWTS regulation section 1.2.B.3, which says use of a vault or pit privy requires written variance request and approval from the Lake County Board of Health. Use of a vault or pit privy requires permitting in accordance with section 1.11, which is a use permit. Vault or pit privies for full-time use in new construction are prohibited where a property can accommodate an OWTS with a soil treatment area. Vault or pit privies may be allowed for limited occupancy on a property which cannot accommodate an OWTS with soil treatment area, or if the dwelling does not have running water. Limited use occupancy means occupancy of a structure or dwelling less than full-time year-round basis. So these structures would not be inhabited no more than 90 consecutive days or a total of 180 days per year. Again, these systems would still be engineered, very low risk vault or privy systems. The state has already confirmed to me that we could, or you could, as a Board of Health, entertain a motion to amend the regulations to quickly, as I've stricken out here on the agenda, I've stricken out the word variance and I've stricken out the word Board of Health, to then rewrite that first sentence to say, use of a vault or pit privy requires written request and approval from the Lake County Environmental Health staff. It would still go through the regular permitting, and it would still have to meet all Reg 43 requirements. It's simply modifying something that I have identified now over the last couple of years of running this program, finding that this is something that our Board of Health honestly doesn't need to take the time for these kinds of public hearings. This one that we're now proposing or on the table to possibly table to another date to ask you to come back another time to approve. So my strong recommendation would be the Board of Health could entertain a motion to make this change to the regulations. I would be submitting that to the state, having it reviewed, and then they would approve it for a permanent reg change. And that would then eliminate this particular or very specific kind of vault and pit privy type situation where it's very backcountry, limited occupancy, and eliminate the need to require Board of Health to have to entertain these.
Thank you for the explanation. I want to respect, the commissioners and, their desire to table this, but I'm wondering, Jeff, how do you feel about this? Is this something you would still want to talk to the commissioners about?
I guess I will say two things. One, thanks for asking that. I appreciate that. I know that Commissioner Marcella would be disappointed not to have a chance to discuss questions she has with staff and have a discussion, to be present with the Board of Health to discuss this. So she would be disappointed if we move this forward, if we moved 3B forward today. I'm just relaying that as a neutral fact. And then, I, for myself, would like to educate myself just a little bit more. I don't see any problems. I'm not opposed to this. I just didn't have time today to think about this whatsoever. And it seems like, a moderately big deal to remove something from a variance to a staff level decision. Again, I'm not opposed to it. I just haven't had a chance to think about it, and I would like a little bit more time.
That's reasonable.
Well, I mean, it's my own fault for not having more time. So if, we are assembled, and there's the quorum to proceed, so I also want to respect people's time and your volunteers scheduled on this, but that's a clear message from Commissioner Marcella and sort of my inclination. And I'm not talking tabling like for 2 months. As soon as we can schedule again, I just want like 45 minutes to think about this.
Totally. So,
So-
I'm fine with tabling this. As I would suggest, though, that we really consider the option of removing the variance having to come to the Board of Health. That would be my suggestion, that if we do table this, that we come back to it, addressing that.
I mean, that would be my clear intent is, as soon as we can reschedule and I guess post appropriately. So Paul, I don't know the posting.
You don't have to repost.
Oh, sorry. No, we're tabling. Yeah, sorry. Thank you. Yeah, so as soon as we can schedule, I think we, the Board of Health does need to vote on this, right? We have to come back as the Board of Health and, discuss and vote on 3B.
How about tomorrow
so there's
afternoon?
two items here. There's agenda item A, which is the public hearing, and that's all I thought we were tabling today, which, again, we have a quorum, so potentially we don't even have to table that today. Potentially we could do a presentation and we could vote on it. I know that this gentleman would not be heartbroken if things went his way today. I know he just wants his permit and wants to build. And again, it's a limited occupancy vault privy that was my recommendation to the Board of Health is that it's a very low risk engineered system that I have now found really don't require Board of Health variances to install these kinds of systems. So it honestly was a clerical issue that if I had built septic system programs before, if I had that experience, I never would have written it that way to begin with, but I didn't have that pleasure. And so now we learned from running programs for a couple of years, which items are now not required, and the state confirmed we don't need to have a Board of Health approve these particular situations. So that's why I was bringing that to the table as a separate, away from the public hearing, agenda item. So there are two separate things here that could be voted on. A public hearing for this particular property, and then part B was just a completely separate agenda item. It happens to tie into what agenda item A is, but as a way to help eliminate having to hold these hearings for agenda item A, if that makes sense.
So,
and I'm certainly happy to answer any questions if Cornelia or Steve or Kim and Jeff, if anybody has any questions from the Board of Health so that I can help educate you more, please ask away, because if we table this, I want you all to feel comfortable coming back in. And Cornelia and Steve, if you need this time now for that education, please take advantage of it, and I'll answer whatever questions you have.
So sorry, just so I understand procedurally. So if we vote on 3B, or if we were to approve 3B today, or if we were to table 3B and meet soon and approve it, that would negate the need for 3A to be revisited. Is that correct?
That is my understanding, yes.
Okay, great. So I mean, I think the question to us is, do we want to discuss and vote on 3B today, or do we want to schedule as soon as possible, and release Jackie to move forward?
You could also move forward today with 3A, and
sure, but let's not. I mean, but if we can dispense with 3B, then we can save everyone time of having to go through the public hearing mechanics. So I mean, to my understanding, and please, everyone chime in, like, we see.
You know what, Jeff? Sorry to interrupt you. I'm just looking at my reg revisions. It does appear that Part B, if the Board of Health was to vote on that today, it actually would not go into effect for 30 days after the vote. So I'm sorry, that Part B would not negate Part A today. We would, if you table that, we would still have to come back to that here. And when you're asking what dates, August 5th or August 12th are both Thursdays and 4 o'clock to, keep it standard. I suppose those dates would be available if it was to be tabled. But here again, my strong recommendation to the Board of Health is I could certainly, share my screen, show you this gentleman's parcel that's way up Weston Pass, large parcel in the middle of nowhere, very low risk situation that could possibly be voted on by the Board of Health today and totally negate the need for tabling and rescheduling to a later date, just to save this particular customer the headache of having to put off a few more weeks of building season above timberline.
So, okay, so understood. I think at this point, sorry, I as chair, I'm going to proceed one way, and we can see how the motion and voting goes. But again, I just wanted to reflect that we have, one absent Board of Health member who requested more time, and I am in that same camp. So, I mean, we need to proceed one way or the other, and I'll take the chair's prerogative, with apologies. I would like to entertain a motion that we table both 3A and 3B tonight. To August 5th or August 12th, as August 5th if possible, August 12th as a backup. And I will then entertain any alternative motions for how to proceed.
Can I just ask what Steve or Cornelius feel like their opinions on this?
Yeah, and sorry, if I may just interject, I wasn't trying to shut down anyone offering opinions, but if we get a motion on the table, then we can discuss it.
Oh, I see.
Right. So sorry, Steve, you have your hand up.
I was going to vote for moving forward on this because I know working with contractors and people trying to get projects done that time is of the essence. If they get a contractor, they want to hold on to them and keep going with their construction schedule and timeline.
Okay, so Steve, I'm interpreting that as a motion to consider 3A and 3B tonight.
Yes, sir. I was.
Great.
I see how bad it is for people to try and get workers and contractors to get things moving forward, and then it's just previous experience in meetings on Board of Health for these types of projects. I didn't see it was that much of an issue to really dive into to find out or to table it, but mostly it was because of these contractors are so hard to get and keep up on a timeline.
Okay, totally understood that point. So we have a motion to proceed with 3A and 3B that is looking for a second. And sorry, to be clear, to proceed with discussing and deciding 3A and 3B tonight at this meeting, that motion has been made and is looking for a second.
I'll second.
Okay. So that motion to proceed with 3A and 3B is on the table. Does anyone want to discuss further? And then we'll go to a vote to begin the discussion of 3A and 3B. Paul?
What about tabling this to tomorrow afternoon?
I am unavailable tomorrow. I'm unavailable till next Tuesday.
I'm unavailable until August 2nd.
Oh.
Not available August 5th.
Yeah, that's what I was concerned about, Steve, because you're going to be gone for a while, right?
Correct, yes.
All right. Well,
Okay, so if I'm understanding, then any delay would be until the 12th, or so, I mean, maybe another date.
so basically, we have you have a motion to hear these tonight.
Yep.
And a second.
Yep. So I was letting the discussion run, but I'm ready for a vote on whether to proceed if people are ready for that.
I'm comfortable with that. I'm very familiar with this project, so I feel comfortable.
Okay, great. Yeah. No, sorry. It's hard to read the room on on Zoom, whether people are waiting to unmute or say anything. So I'm just going slow. So I will do a roll call. So to repeat, this is the motion on the table to proceed with 3A and 3B right now tonight. I will vote no. Steve?
I would vote in favor of moving forward.
Okay. Sorry, I just realizing I need to tabulate this. Kim?
I'm in favor of moving forward.
Okay, thank you. And then Cornelia, sorry.
Yeah, just move forward with it.
Okay, then the motion's passed and we'll proceed tonight.
Thank you all very much for taking a look at this. So what we have is a property up Weston Pass. It's above timberline, high mountain terrain, only accessible from end of June through mid-September, sometimes into October, depending on weather, evidently. This is a limited occupancy proposal for a single family. It's a small cabin that will not have any running water. They will be limited to 90 consecutive days, total occupancy of 180 days total per year. It is an engineered system, and it will be a poly, which is like a plastic tank that will hold sewage until a pumper truck can come up and pump. This particular property is next to Leadville Backcountry 2's ski hut that's already out there and is already a permitted vaulted system and on a pumper schedule. It gets pumped about every 4 years when it fills up. This one will be the same pumping schedule as the other pumping truck, or if for any reason it was to fill up sooner, it will have an alarm system to notify the property owners that would need to be pumped sooner, but they don't anticipate it. This is a small family versus the other hut next door is a rented commercial use structure. So what we've also got here is it's proposing a very small cabin, again, with no running water. a 1,530 gallon vault privy tank to be installed into the ground. It will be tethered to the ground to prevent it from shifting or popping back up if there was any high groundwater table or anything. That's why it's engineered. Does anyone have any questions on this very simple system?
None for me.
None from me.
None from me.
I would like to mention that this is also requiring an engineered foundation for the building. I think it's a 1,400 square foot building, and it'll be heated by wood. And the need for engineering is because it's all going to be on piers rather than on a typical foundation. So the code actually requires that if you're going to do something more out of the ordinary, you need to engineer it. And I think that the only reason that this building permit is being withheld is that we don't have a permit for a waste disposal system yet.
And so again, this particular system, it's engineered and it's such a simple system. It's so very low risk to the environment or risk to any public health. Obviously, there's no other major neighbors or anything out there. This is the exact kind of system that in part 3B we will get to, but just remember that when we get to part 3B. So my recommendation to the Board of Health would be that this system could be approved by the Lake County Board of Health for a variance. It would go through normal permitting and have a use permit for limited occupancy use.
Do you have that recommendation written down somewhere, Jackie? Is that on the agenda?
Stop sharing my screen and the agenda. Let's see, where's the agenda? There it is. So it would be for the Board of Health to approve a variance request for Horning Consulting LLC to obtain a permit for a new limited occupancy vault privy OWTS waste system with no running water at 114 County Road 7A, Leadville, Colorado 80461, parcel number 2747350-00-050 in Lake County, Colorado.
And then you said to add with limited use. Oh, it says limited occupancy. Okay.
And then I just have a question procedurally, because it's a public hearing, and granted, I don't believe any public's on. Does that mean we need to open and close, open for comment? Like, I've been documenting the timing of your conversation, but I just didn't know if we still have to open it or see if anybody had sent in any letters, because it's part of that process, right? We send out if there's anything that needs to be read into record.
Yeah, sorry, thank you. That's a great question. I'm assuming we do need to say something to that effect. So again, it's hard to read the room on Zoom, but I will just go ahead and start, announce that, this is the public hearing on whatever day this is, July 22nd. At 5:14, we are in a public hearing regarding a variance request for Horning Consulting LLC to obtain a permit for new limited occupancy vault privy on-site wastewater treatment system with no running water at 114 County Road 7A, Leadville, Colorado 80461, parcel number 2747350-00050 in Lake County, Colorado. At this point, we are taking a moment to one, see if there is anyone on in this meeting who would like to make a public comment, and two, to request staff to let us know if there are any, if there have been any submitted public comments or questions or letters related to this hearing. Hearing none. Oh.
And my cell phone number is the stray number that's out there, the 719-427-0179. That's me. So there's appears to be no one else on. And I have not received any written or any other inquiries into this public hearing. However, to make it very clear, yes, all the adjacent property owners were mailed out official notices of today's public hearing. So they had over 22 days of public comment period to get those comments in if they had any such comments. And we did not receive any.
Okay, great. Then, and please anyone correct me if I'm going astray on procedure, but I think at this point I would close the public comment period, you know, or section of this hearing, and we'll continue. So Jackie, back to you to keep walking us through this.
I might suggest that closing the public hearing should be voted on. So you probably want to entertain a motion to close the public hearing.
Okay, thank you. I will entertain a motion to close the public hearing regarding the variance request for Horning Consulting LLC.
I will make the motion to close the public hearing.
I second it.
Thank you. Any further discussion before we vote on closing? Then I will vote yes.
Yes.
Okay, Kim, yes. Steve?
Yes.
Cornelia?
Yes.
Okay, we have closed the hearing. So again, sorry, help me with procedure. So should I now entertain a motion to vote on the variance request itself? Paul,
I think the way to do that is just to see if there's any further discussion before you entertain a motion.
Yeah, thank you. And yeah, great. Okay, so any further discussion from board members on the variance request?
None from me, thank you.
Okay,
None from me.
great. Steve, I'm assuming none, and none from me.
None for me. Sorry, it's taking a
Great.
minute.
Yeah, no, again, just talking slowly to give people time for the mute buttons. So now I will go ahead and entertain a motion to approve the variance request for Horning Consulting LLC. So if I could get someone
Okay,
so move.
I move to approve the variance request for Horning Consulting LLC to obtain a permit for a new limited occupancy vault privy on-site wastewater treatment system with no running water at 114 County Road 7A, Leadville, Colorado 80461, parcel number 274735000050 in Lake County, Colorado.
Thank you. Do I have a second?
Second.
Great. So proceed to voting. I'll vote yes. Kim?
Yes.
Great. Cornelia?
Yes.
Steve?
Yes.
Great. That is approved. Should we move to 3B?
Please.
Okay.
And so again, just 3B would then be to reduce the number of Board of Health public hearings regarding OWTS, Colorado Department of Public Health and Environment has confirmed that with my conversations that vault and pit privy approvals can be approved by staff, as Reg 43 does not have a legal requirement that the Board of Health has to do it. Therefore, we can amend our Lake County OWTS regulation section 1.2 B3 to say use of a vault or pit privy requires written request and approval from Lake County Environmental Health staff. Simply changing that first sentence there. So my strong recommendation to the Lake County Board of Health would be that we make a vote to amend our regulation to allow staff the opportunity to make these very low risk engineered systems approvable by staff and not have to go through the variance process taking up Board of Health time.
Can I say something really quick? I feel like I need to recuse myself because I am environmental health staff. So I feel like it's appropriate for me to recuse myself.
Okay, Kim, thank you for that. And that's probably safe to err on the side of that. And I probably should have said that earlier in the hearing. So maybe go around. Does anyone else feel a need to recuse themselves or disclose any sort of ex parte discussion or anything of that nature? I do not have anything like that. Cornelia and Steve, we all good to proceed?
We can proceed, yes.
Great. So, so I will entertain a motion, and we can discuss this further before voting, but I'll just entertain a motion to get it on the table let me see, give me a second. I will entertain a motion to amend the Lake County OWTS regulations, section 1.2 B3, and that language has been read by Jackie Littlepage, and it is in the agenda as posted. So I will entertain a motion if anyone wants to just say so moved.
I think, Jeff, you probably want to close public hearing or public comment for even though it's just procedural.
Okay.
So entertain a motion to close public comment.
Okay, thank you, Paul. Okay, so first I will entertain a motion to close public comment on this proposed amendment to Lake County OWTS regulations. If someone could so move.
Yeah, come on, Cornelia or Steve, just say
yeah.
so moved.
I approve.
So moved. Huh?
So moved, and a second, Steve?
I second.
Great. Any further discussion about closing public comment? If not, I will vote yes. Steve?
I second.
No.
Or
Yes.
yeah, you vote yes if you approve closing public comment.
I approve closing public comment.
Great. Cornelia?
I approve closing comment.
So public comment is closed, and now we'll come back. I think it would be good to still get, if I could get someone to, well, I'll read it again, sorry. I will entertain a motion that we amend the Lake County OWTS regulations, section 1.2 B3 with the language that has been read in and discussed by Jackie Littlepage and is in the agenda. So if someone could so move.
I move to approve.
Great. So moved by Steve. Cornelia, could you second, please?
I second it.
Excellent. Any further discussion before going to a vote? Hearing none, I will abstain. Steve?
I approve.
Okay, and Cornelia?
I approve.
Great, so that is approved by the Board of Health.
I'm not sure it is. It only had 2 positive votes.
Is that
Did you-
not a majority of the quorum present?
Well, are you on the board? And Jeff, are you on the board?
I believe so, yeah,
Did you abstain?
I did.
So that's only 2 votes.
It isn't, well, I'm unfamiliar with the,
Well, you need a quorum. There's 5 members to the board, and only 2, and you need, so 3 is a quorum. Only 2 voted positively. So I don't think that it does pass.
well, okay. So, I mean, we need to go pull up like rules because I guess I was thinking, without having read our rules of procedure for the Board of Health, that with Kim recusing, we have quorum to have a valid meeting of the Board of Health, but there are 3 voting members for this motion. And it was, 2 in favor, and that is a majority of the eligible votes here.
No.
But I understand your point, Paul, that may not be the correct math.
Yeah, that's not how it works. It would have to be 3 votes in favor.
Okay,
So bring it up at the next meeting, or try another vote. Jeff, why are you abstaining?
because I'm reflecting both Commissioner Marcella and my desire to have more chance to discuss this amendment to the county regulations with staff.
Okay. So the action has occurred. It'll probably have to be brought up again at the next meeting.
Yeah. Do we need to actually, I guess, no, we don't need to vote further to table or anything, right? It's just, would be something to bring back up on a future agenda.
Yeah.
Mhm.
Okay. Well, sorry for that. But so just to summarize, so we did vote to approve the variance request on 3A, agenda item 3A. And we will bring up the topic of agenda item 3B at a future meeting. Again, please correct me as somehow in the dark raininess, I'm getting a little tired here. So I think we can move, close out agenda item 3 at this point, and just discuss the next meeting date, and then adjourn. So if I heard people's schedules, it looks like the 12th is the next time. Are people open to trying to find an earlier time? I don't think there's the urgency necessarily since we granted the variance request on 3A. So should we just stick with August 12th as the next available day?
Well, and you can actually move it on to the next, quarterly Board of Health meeting. Colleen, did she drop off? Or is she still here?
Yeah, no, we haven't scheduled a quarterly only because we have not been able to hold quarterlies with everything with COVID and variances. We've been kind of just, do we need to set the next meeting? So where are we? So if we were to do quarterly, that would be right, October, November, December, right? Is that there? It would start in October, or is it? Yes. And so we can set a date for October unless something comes up prior to that. I think because of the Delta variant, I would like to start something. I would like to set something up sooner. So even if I am out of the office until August 16th, so I wouldn't be able to attend on the 12th, but I'd be open for something that following week or the first week of September.
Would
Jeff,
August
I can't-
19th, would August 19th work for everybody? Well, speak at once.
I'm available.
Oh, unmute. Yeah, 19th is good.
Steve, Cornelia? Steve says 19th works.
Oops, I'm
If you've got a
sorry, I
calendar,
was
can you say
muted.
what
It's good for me
date
also.
that is?
And from what I can see, it works for me. And then from what I can see on Kayla's schedule, it's available at this point in time. Obviously, anything can change. And I can't speak for Kayla, just what I can see right now. So it sounds like August 19th would be the next meeting at 4 o'clock.
Okay. Then I think I'll entertain a motion to adjourn this Board of Health meeting on July 22nd.
I move to close the meeting.
I second.
Excellent. I vote yes.
second.
Oh, sorry. I'm assuming discussion. But I will vote yes. Steve,
I'll second.
or
It's a yes or no.
Yeah.
Yes. Kim,
Yes.
Cornelia.
Yeah.
Great. So we are adjourned at 5:32 on my clock. Thank you all very much.
Thank you so much. You guys have a great evening.
Thank you.
Jeff, do you think that other meeting is still
Bye-bye.
going on?
I don't know. I was
Yeah.
gonna text folks and I haven't heard anything. So it well could. I mean, could well could. I don't know.
Yeah, I think
It
I'm
was
gonna,
in full blast when I was there 4. It was full on.
yeah,
So,
I'm gonna try.
all right. I'm gonna end the meeting for all, unless you guys need to chat.
Can I just
Bye.
inquire, was it about the county manager position or?
No, this is a hearing on the Pan-Arc Metro Special District.
Ah, interesting. Thank you.
So long.
Thank you all.
Okay.